Hurried Gamble. Opacity in communication is dangerous when there is high vaccine hesitancy. So opacity in communication, it basically means that it basically means the misunderstanding between the government a- and and normal people is dangerous when there is a high vaccine hesitancy. When there is going to be a soon vaccine rollout, the misunderstanding between the citizens and the government is not a good thing. The stage is set for the biggest vaccine rollout in India's history, with the Drugs Controller General of India formally approving two vaccines um, for restricted use under emergency conditions. Covishield by the Serum Institute of India (SII) and Covaxin by Bharat Biotech. So, so the Drugs Controller General of India, it has formally approved, means it has officially allowed the emergency use of two vaccines, and those two vaccines are the Covishield vaccine, which was developed by the Serum Institute of India or SII, and the other vaccine is the Covaxin, which was developed by the Bharat Biotech. So under some special situations of emergency uses, the India's Drug Controller General of India, he had formally allowed the use of these vaccines. Two other vaccine candidates are in the fray too. These two set a precedent for how future COVID vaccines will be evaluated and administered. So these are not the only two vaccines which will be allowed by India. Um, as time passes, even more vaccines will be introduced to India. But these two vaccines will be an example to those vaccines, to show them to show how a vaccine can be distributed and administered in India. India has been long known as a manufacturer of vaccines, but less so as one that can develop from scratch, test and then provide it to the world. So India, in all over the world, India is popularly known for producing vaccines, but it is not known for producing vaccines right from the scratch. Sometimes it may take help from the other countries, or it may get its resources from other countries, but it never made a vaccine out of scratch and then provided it to all the countries. It never did so. So it is not known as a country. It is not known as a country that can develop the vaccines on by its own. The pandemic offers an unprecedented opportunity to establish those credentials, but already a key step of establishing the vaccine's efficiency or efficacy in the India population before rollout has been sidestepped. Um, so during this period of this, or so during this period of the vaccine rollout of India, India now has the opportunity to show that even India as a country could make its own vaccine out of scratch and then distribute it to the world. A double-blinded phase 3 trial where some volunteers get the vaccine and some do not, and the rate of the disease in both arms is compared to determine the vaccine's ability, is among the foundations of the evidence-based vaccine. So to find out the efficiency of the vaccine, um, this process contains two volunteers, and one of the volunteer will be given the real vaccine while the other won't be given a vaccine. But he will be told that he is given a vaccine. So if he feels any better, then the efficiencies between giving nothing and giving something can be compared. The pandemic of The SII, because of its agreement with AstraZeneca, has furnished data from a phase 3 trial in UK and Brazil, but nothing publicly on how protective the vaccine was in 1,600 Indian volunteers. So, AstraZeneca, it has produced some data on the phase 3 trials which it has conducted in particular countries like Brazil and UK. It has also conducted a phase 3 trial in India too, but it did not yet publish the results of the trials in India. and it has tested 1,600 volunteers. All of the leading vaccine candidates, Pfizer, Moderna, and AstraZeneca itself, made public at least partial results of the vaccine's abilities in their own populations before these were given a go ahead by the respective regulators. So, and there are also several other countries to which AstraZeneca um, did not provide total results. But at least for those countries, it at least provided partial results. But in the case of India, there was no sign of results which was provided by AstraZeneca. Bharat Biotech, which is conducting such a phase 3 trial in India, is yet to furnish similar data because it has not been able to finish recruiting the required number of volunteers. So now, an Indian company, Bharat Biotech, will test its vaccine, Covaxin, and until now it has not done its phase 3 trials because it did not have the required number of volunteers. It needs to conduct a phase 3 trial. But now, as it has the number of volunteers required for the phase 3 trial, now it is conducting it, and soon it will give us the results. The Indian data furnished by the companies only attest to the vaccine safety and it's evoking some immune response. However, this pandemic has revealed multiple instances of therapies and interventions, from, from convalescent plasma therapy to a slew of antivirals that seem to work well under the idealized lab conditions, but did not measurably protect in real world hospital conditions. Currently, vaccination is not only the method to get rid of the vaccine or to get a protection against the vaccine. There are also some therapies which could protect ourselves, from the virus. But these therapies like the antiviral therapies, they seem to only work under the favorable and preferred conditions in a lab, because in a lab everything will be set for the therapy to take place. But in the real life situations or in a hospital situation, um, those conditions or situations won't be favorable, and so because of that, even the results or even the effect on the humans who made it through the respective therapies won't be as effective. The concern from approving an untested vaccine is that it makes it nearly impossible to conduct a proper phase 3 trial. So, if someone approves a vaccine which was untested under the situation of an emergency, it would make the vaccine it would only make the vaccine more unfaithful. It will be unethical to expect volunteers to participate in a trial where there is only a 50 chance of being administered that the actual vaccine when they have the option of the real dose elsewhere. Um, so the concern. So as I said, the vaccine, it was not officially approved, but yet the government has approved to use the vaccine under this emergency scenario. So it would be really unethical for anyone. It would not be moral to ask a volunteer to participate in a phase 3 trial or the testing period of this vaccine, because no one knows what are the side effects of the vaccine, and if the vaccine could really solve the problem of COVID-19. So there is only a 50% chance that the person is getting the vaccine that is efficient in curing the disease. Instead, the volunteer, he obviously has another chance to participate in the phase 3 trial of another vaccine, and if that vaccine is tested and it is said that this vaccine really works, why would that volunteer take a vaccine um, from this vaccine company if he can take the vaccine from another company which ensures a proper vaccine? So it is hard to imagine why an emergency use authorization of these vaccines was hurried through. So yes, obviously, no one knows why the Indian government has taken this step up of introducing the untested phase 3 untested phase 3 trial vaccine. Opacity marks the government's communication strategy in a country where the distrust of vaccines remains in spite of the years of vaccination programs and elimination of grave diseases. So India is such a country that has gone through many long vaccination programs. But even though few people of India, only very few people of India trust the vaccines or the vaccination programs of India. So in such a country which already has some problems, with faith on the vaccination programs, the government is now adding another problem. It is adding opacity of communication. So with the addition to the with the addition to with the addition to the with the addition to the unfaithful vaccine programs in India, the government now has added the problem of misunderstanding. So the unfaithful nature of people on vaccines, it will increase even more. The government neglects this at the country's peril. So if the government neglects or ignores this problem, it is actually keeping the life it is actually keeping the lives of all the people of India at risk. Thank you.